Where is the fluid? So fluid right here, right? It's pretty subtle, eh? So that's why it's important to kind of
A little bit, kind of like circle that. Yeah.
right down here. This right here,
That's the
above the spine,
Sorry.
like right down here,
that's the blood vessel.
or up here.
Sorry.
Yeah, there's something that looks like it might be pulsatile there. I would say it's hard to say. I mean, it's always hard when you don't have the actual probe on your hand and you can't take another good look at it. But I agree, there's something more hypoechoic down there. It doesn't look like fluid so much because it's not static. It looks like there's some movement, as Faisal was kind of saying. Yep.
There is movement from your
Show it for the recording.
Yeah.
Oh, so this area right here. Okay, gotcha. Yeah, so I would say that looks more vascular since we're seeing that kind of movement there. I'm not necessarily, I don't know which vessel it is because it's a bit of an unusual thing, but something involved in the liver.
Start of seeing the stomach fluid.
Perhaps, yeah. But yeah, the fluid area we're looking at is up here. You actually can see some of the fat surrounding the kidney quite nicely here. But yeah, that little strip there is a bit more than we're liking to see. So sometimes it can be fairly subtle. Next one, not so subtle, right? So here's a big strip of fluid sitting on top of the kidney. And then as you get into the liver edge, what are we seeing behind the liver here? What's all that? Yeah, dirty shadow, right? So stomach in all likelihood. Okay. Next one. What are we seeing here?
Clot.
A what?
Clot.
Yeah. So probably a blood clot. It might even be like it's got a very similar echogenicity to the liver. You wonder whether that's even like a piece of liver or something that's turned up. But I would say it's most likely probably a blood clot just because that seems a bit more likely. But a ton of blood here. This is a patient that's got a lot of blood in their abdomen. Now, I would say, who of those three videos has the most blood in their abdomen?
Probably this one.
Yeah, you're right. Probably this one because we all have common sense, but we don't know. So we know that looking at fast images should not in any way dictate how much fluid we think someone has in their abdomen. And so that should be something that's clinically kind of directed as opposed to sort of directed by any particular image. Quick pearl about the right upper quadrant. Make sure you're fanning through the entire organ. So why is that important here? Does this look normal at the beginning here? Pretty normal, eh? Like right at the beginning. And then as you go through, you're seeing some areas that don't look so normal. So we're seeing a little bit of area up here, right there, right? And maybe something even up there too. So yeah, just a quick point that it's not as good, it's not sufficient, I should say, to just get that kidney-liver interface. You've got to sweep through and sort of see all through that right upper quadrant box. This is a nice little image just demonstrating the properties of dependency of fluids. So in older kids, and we're typically talking about sort of kids above the age of 8, but obviously every kid's going to be a bit different. The fluid tends to sit in the right upper quadrant, which is the classic teaching in adult literature, of course. Whereas for the majority of our kids, which usually we're seeing younger kids as a rule, it tends to be that the pelvis is the most dependent area. So I would say that we probably have as many positive pelvis fasts that we've done here as we've got right upper quadrants. And that's probably not as true in the adult world. But 8 years old is that number you can kind of quote, but I would say that obviously that number is, variable. Left upper quadrant. So here's our video again for the left upper quadrant demonstrating the technique. Now, what's different about the left upper quadrant than the right upper quadrant in terms of your technique?
Superior and superior.
That's right. More superior and more posterior. So your kidney, in this case, if you look at any anatomy image of the kidney, it's going to be sitting a bit higher and it's going to be sitting a bit more posterior. And so you just have to keep that in mind. We talk about the knuckles to the table when you're looking at the images of the kidney, particularly on the left side. Now, I would say that that's nice, but I actually don't even use knuckles. Like I would just hold the probe from above. So, especially when you're doing it from the patient's right side, I'd suggest holding the probe so that you are allowing it to be on the table more than your hand, so that you can actually get as far as you need to posteriorly, because obviously it can surprise you from time to time just how posterior you need to be to get these images. Otherwise, the view is very similar to the right upper quadrant. You're looking at that area between the spleen and the kidney. It's important to see the edge of the spleen, as well as it's important to see the area above the spleen if you can. I will say that this tends to often be, as compared to the right upper quadrant, a more indeterminate scan in some cases. The reasons for that being that sometimes the spleen's pretty small. You can get a stomach that sits between the spleen and the diaphragm, and so you don't see the diaphragm coming up to here. It's less often the case that you can get this perfect view. Often the stomach will kind of sit in and around here, and you kind of get this, I should say here, I should point this out on the video, of course. Where's my cursor? Can't see it. Sorry, let's go back here. Oh, I can't see my cursor anymore, David.
What's wrong?
Oh. I don't know why. Anyways, sorry for screencast people that can't see where I'm pointing out. But basically, the area right in and around where it says the subphrenic area, where the arrow points to, that area can often be clouded up by a stomach that kind of can make you think like, am I seeing something funny there? Am I seeing a smashed spleen or something? No, it's probably just stomach. And that can also get in the way of the diaphragm and looking at things like the spine sign on this side. So just keep in mind that you're not necessarily going to obtain this perfect image, particularly on the left upper quadrant. More often than not, in the right upper quadrant, you should be able to get the images we're looking for, because the structures are pretty homogeneous in most people. So again, fluid here, we'd want to look at that splenic tip and looking under here as well, and knowing that it's less likely to be positive than the right upper quadrant, statistically speaking. So here we go. How many areas of fluid can we see? A lot. We got 1, 2, 3. So, I mean, it's all the same thing, right? It's all surrounding the spleen there, but this is a very positive left upper quadrant. I would say I'm not sure about that, because we're sort of seeing it here coming down, right? Maybe in here there's something. It's a bit. I think that might be more of a mirror. Yeah. Oh, Mark's chiming in from the background. Yeah.
Mirroring, and you will sometimes see a triangle that is like 3 millimeters, and I would consider that to be more like physiologic fluid than diffusion or anything. One of the questions is, where is this, right, that we're talking about? Seeing mirror,
okay.
spine sign.
So, now I got the cursor again, right here. So this is probably your mirroring artifact here. And what are you talking about there, Peso?
Like there's a bright hyperechoic line that continues.
There's a bright hyperechoic line that continues. Above?
No, left.
Left? Here?
Down.
This one. Where are you?
Never mind.
It's like the deepest part of the mirror.
Yeah.
Bright line.
Yeah.
I mean, I think that's probably a reflection of the pleural surface there, like the the diaphragm, right?
Yeah, never mind.
It's gonna be a long year. Okay, so that's probably mirroring right there. And then as far as the spine sign, like what you'd really be wanting to see to confirm your spine sign is the spine, right? So you're seeing something that looks a bit more unusual here, I agree, but your spine is this thing down here, that sort of jagged line, and you're not seeing that continue up through the pleura. You're getting this more kind of unusual appearance here, which we think is more of a mirror artifact.
But a mirror artifact shouldn't give you another diaphragm, because the mirror is the diaphragm.
Correct. Yeah, you're probably right, Magali. I don't know what this structure is here. It's probably
ignore it.
I would say
Whatever, like-
when you're starting to see artifact,
Yeah.
whatever's beyond an artifact, you kind of ignore, right? Like there's a lot of like I don't think that's useful information that you're looking at down there because I think this isn't fluid because it's not hypoechoic and we're not seeing a spine like behind it. You're seeing something that isn't like that this isn't the real anatomy, right? This is somewhere that the spine should be, and if you're not seeing spine there, then that that's not real information. Does that make sense? Like there's only that the spine's there unless this kid's got a missing spinal column in that area, and this is what the thing is there, which is not what I'm trying to get you to think, but this is obviously just misinformation.